And then the part of it that I really struggled with, and this kind of leads into the consulting origin story too, of I was really glad to be taking this wide angle lens, to be working on big picture public health, to be thinking at the level of policies and systems. But I was also getting kind of increasingly frustrated that, I was taking this 30,000 foot kind of view, and it made me feel really disconnected from the communities on the ground where the work was actually taking place. And it, like, I really struggled, like, okay, we put all this effort into this report. Like, what does that mean? Who's reading this? Is it having any impact? And for me, like, that disconnect was too much. Like, I knew I really wanted to in some way, shape, or form be more connected to the communities in which the work was taking place.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 90. Hi everyone, Omari Richards here. Thank you all so much for joining once again. Be sure to follow me on Instagram at the PH Millennial. Be sure to subscribe if you have not as yet. I don't know what you're doing if you're listening to this and you have not subscribed. If you've not left a review, that definitely helps get the show out to more people and just show support. I would greatly appreciate that support. If you'd like to support in other ways, you can go to thephmillennial.com/support to see other ways you can support, or you can go to buymeacoffee.com/thephmillennial and support there. Really enjoyed today's episode. I think it's the first person I've had who's had an undergraduate in biomedical engineering, but I just love the story and the path that she's taken to get into her consultancy company right now. And I love her thought process of the systems change. And I like the discussion that we had between like systems change and then ground level work and how all of that plays out. And just like having the intentionality and like a growth mindset and being open to opportunities is just important. But anyway, I hope you all enjoy this episode. Today, we have someone who leads efforts to help communities and the organizations working with them address social determinants of health and health inequities by strengthening multi-sector efforts. She got a Bachelors of Science in Biomedical Engineering and Economics at the University of Virginia. She then went on to get a Masters of Science in Public Health at Harvard University School of Public Health. She then got her Doctorate of Public Health at George Washington University Milken Institute School of Public Health. She is a TEDx speaker and is the founder and principal consultant at Pop Health, or Pursuit of Public Health, LLC. We have Dr. Vinu Ilakkuvan, DrPH, MSPH. Welcome to the show.
Thank you so much for having me.
Yeah, it is my pleasure. I'm glad that you reached out and that we can get you on the show. Is it Pop Health before we get into anything?
Yes, Pop Health.
Okay, that makes sense. Population health as well, and then Pursuit of Public Health. Nice. Okay.
Yes.
Just making sure. So how are you doing, and how you been coping during these crazy times you have had or having?
Yeah, I know. It's kind of extended. No, we are doing well. I think very fortunate in a lot of ways, and trying to remember that and be grateful for that. But I think all of us have been struggling with all sorts of things, with decision fatigue, with kind of blurring of boundaries of home and work. And we've got two little kids who were fully home for a year, and now we're back in school, but that comes with its own stressors as well. So I think coping as best we can, trying to appreciate the time we have as a family, and trying to just take it a day at a time.
Yeah, absolutely. I think we all have to take it a day at a time. And I could only imagine the things that you have gone through this pandemic as like a parent because I know it is tough. As you said, your kids are home for a whole year, and that's a whole different life. And I'm guessing that brings along a lot of joy and happiness, but then it also brings along, oh, I gotta balance this and then work and all the other things that are going on in life. So I can completely
Exactly.
understand that. But yeah, we are here where we are today, and I'm glad that we can get to chat and talk more about public health and your public health journey. So how do you identify, and then tell me a little bit about your personal background?
Sure. Yeah. So, yeah, my pronouns are she, her, hers. I am Indian American. I was born in India, but was 2 months old when my parents immigrated to the US. So have completely grown up here, but, very, very much straddled both cultures, both growing up and now, and really enjoy being able to do that and being able to kind of take the best of both worlds, and that certainly comes with its struggles and identity struggles and all of that, but also comes with a lot of richness of being able to just take from both cultures, depending on what works. So I have really appreciated that, both growing up and now, and now, as a parent, being able to kind of foster that in our kids as well. But yeah, and then in terms of my background more broadly, I was an engineering major in college, and kind of quickly realized that none of these career paths were really sounding like what I wanted to do or what felt like a good fit. And I had always loved writing and did journalism, all through middle and high school and college. And so was really kind of grappling with, how do I find the intersection or balance between sort of wanting to do something kind of in health and medicine generally, as a biomedical engineering major. So sort of that was interested in kind of health and medicine, knew from the beginning that I didn't want to be a medical doctor, but thought biomedical engineering would be a good fit. And then when I was sort of struggling with career paths and wanting to write more and talk to people more, kind of quite literally stumbled upon public health, which I did not know was a field when I was an undergraduate in college, which I don't think anyone can say anymore, especially after COVID. But at the time, it wasn't very, well known as a field or mainstream. And so kind of stumbled upon it and really felt like it brought together all the things that I was interested in. So kind of went from there in terms of transitioning into public health.
Okay, awesome. I look forward to digging more into that and how you stumbled across it and fell into it, as well as the thinking behind your biomedical engineering degree and what you expected to do with that. And I think going back to your point of you being born in India and growing up in the US and just having that intersectionality, and one thing that I've said on the show and I see in real life is like just having that exposure to two different cultures is a great learning experience in itself. I'm
Yeah.
glad that you're able to embrace a lot of that into your life as well.
Yeah, I think it really has given me an appreciation for different perspectives, and being able to, I think, just the value that brings, whether it's a differing perspective or a perspective you disagree with, or whatever it is. I think just having, like you said, having the exposure of having kind of seen that in, day in and day out, has made me appreciate the value that can bring, and kind of looking at things in a different way.
Yeah, absolutely, absolutely. So before we get into your bachelor's and your further public health story, what does public health mean to you?
Yeah, I mean, public health to me, I feel like is really in many ways my purpose, my soapbox, whatever you want to call it. It has really become that for me. I think, I think of public health as taking that step back, taking a systems level view, being able to impact entire populations. I think it's Hopkins that has a motto of saving lives millions at a time, or something to that effect. And I feel like that is what public health does, by taking the systems level view, by moving to thinking about, how do we prevent things in the first place? And really all of that together, for reasons we will dive into later, I'm sure, all of that is incredibly appealing to me, and has been from the beginning, and I think is why it has become kind of so central to what I see as my purpose.
And I like that a lot, because I feel very similar in a lot of ways, that it's just it created this space that I didn't even know existed, of this thing that I can do that's like just impactful on a scale, and doing this work to improve populations and in an equitable kind of way. And I just think it is that way for a lot of people coming into public health. Like it really is their calling, or they really are just pulled into this kind of work, and just helping and working to help and improve communities. Okay, now getting into your undergrad story. So you got your Bachelors of Science in Biomedical Engineering and Economics. So what was the thought process for that?
Yeah, absolutely. So it's funny. So you'll notice a lot of like stumbling into things in my story. I kind of stumbled into biomedical engineering as well. So in high school, I feel like, not just in high school, really throughout my life, like I've always been the person who's like interested in all the things. So even in high school, like, loved English lit, loved that side of things, also loved science. And actually really debated about whether I wanted to go kind of a science route or a journalism route when I was applying to colleges, and ultimately decided to go the science route, and then sort of with the idea that like I could always also do journalism. So I was going the science route and was thinking about a kind of like going the biology major route, and had like a random conversation with a family friend where, she was like, you might want to consider biomedical engineering because your classes will be smaller. And it'll be, a little bit more kind of one-on-one attention and whatever. And so that kind of stuck with me. And I was like, yeah, that sounds good. So applied to biomedical engineering programs, kind of based on that offhand comment. And then I had taken econ in high school and like really loved it as sort of, I feel like one of the few subjects that makes logical sense. Like I feel like, you're taking biology classes or whatever, and you're like, okay, this must be true because they're telling me it's true, right? I have no way of truly knowing, what's happening inside a cell or inside our body or whatever. And similarly with math, it's kind of theoretical. Again, you're kind of going with what they're telling you. But economics, when you think about supply and demand and how these things interact with each other, was sort of, made logical sense. And I found that really appealing. So yeah, that's how I got into those two subjects in college. And, ended up being really grateful to be in an engineering school because of not only sort of having a smaller community and smaller classes, and all of that was lovely, but also just this kind of deep-rooted sense of like taking a systems level look at things and really thinking about those structures and environments and how do we change those things. I think really shaped the way I see the world, really to this day. So
And that is a very, it's not a typical path you hear someone good into public health taking, but as you said, it does bring like a different viewpoint and a different vantage point that you can use for the public health work that you're doing. Okay, so during your time as a biomedical engineering and economics major, you were an American Associate for the Advancement of Science. So tell me about that experience.
Yeah. So That was actually an internship through the engineering school at UVA. So the UVA Engineering School has a science and technology policy internship program. And the applications for that program kind of opened up pretty soon after I had kind of stumbled upon public health as a field and was starting to think about, policy and all of these things, and saw this application for this internship program through the engineering school and was immediately, really excited about it. And through that internship program, they helped place all of us in internships in Washington, D.C. And I got placed at the Center for Science, Technology, and Congress at the American Association for the Advancement of Science, AAAS. And that was a really formative experience for me. It was my first time going to anything on the Hill. So that center at AAAS sort of played a translation role. So they would go to hearings on the Hill that were related to science and technology issues, stem cell technology, like patents, things like that. They would go to hearings and briefings on the Hill and then write up kind of briefs that would go out to their membership of scientists. And then they would also take kind of scientific information that was coming in from their membership and translate it into policy briefs for the Hill. And as an intern, I just kind of got to absorb a lot, got to go to these briefings on the Hill, got to help synthesize some things, but, mostly just really absorbing all of this, kind of seeing how this whole policy sphere worked. And it was a really exciting, formative experience.
Yeah, and it's always great when your school has a place where they have the internship set up and they try to help you and support you in the best way. So key tip, if you're looking into undergrad school, see if they offer those types of internship programs and things like that are already set up and allow you to get the experience that definitely sounds very, very great for your career and everything that you've done.
Yeah, absolutely. And it's a program that, I'm still involved with now as a mentor for students who come through it. And I completely agree with everything you said. It's such a valuable experience, and certainly not one I can imagine having gotten without the structure of that program in place.
Yeah, absolutely. And then you also were a Virginia Governor's Fellow. You were in part of the Virginia's Governor's Fellows program. So tell me about that.
Yeah, so that too, again, that was actually between undergrad and graduate school. So the Virginia Governor's Fellows program is, open to, I think it's all kind of graduating college students, and a similar kind of, application process. And again, it was sort of, I knew I wanted to go into public health. I was applying to graduate schools in public health. And so the idea of kind of getting state level policy experience and exposure to that and what that looks like was something I was really interested in, and I was working on health information technology related projects when I was a fellow, and I feel like what I really took away from that experience was, the governor's fellows, I forget, there was maybe 20-ish of us, and it was a really unique experience in terms of getting to know the other fellows, and everyone was placed in sort of different places within the executive branch of the state. And really just, I feel like, again, kind of absorbed a lot from just going to different events and hearing about what the other fellows were doing, as well as having some, experience with a topic that I didn't know much about going into it in terms of health information technology, and seeing kind of how different policies affected that, and, the different stakeholders who were interested in shaping policy around it. So and another, I think another really kind of formative experience, and I feel really fortunate that I had the opportunity to do those things going into graduate school in public health, and being able to kind of take in my coursework, having kind of like with a sense of what, how these policies were shaped, was really valuable.
Yeah, absolutely. And I think like when a lot of people on this podcast say that they recommend people to take a gap year, it's because of those kinds of things, because you do get to like work and get the experience that actually helps you better understand and like just solidify everything that you're getting from your graduate program afterwards. So I definitely could understand that. And then a little earlier, you said that you did journalism through middle school, through high school, and through university as well. So I wanted to ask a little bit about what kind of journalism did you do, and how did you get involved in doing journalism during undergrad?
Yeah, absolutely. So yeah, I've always really enjoyed writing, and in middle and high school wrote for the school paper, and just really, I've always just really loved telling a story. I've done Indian classical dance my whole life since I was 5 or 6, and that is a very much a storytelling art form, and have really just enjoyed being able to tell stories both through dance and through writing. And knew when I came into college, even though I wasn't majoring in journalism, that I wanted to be involved. So I got connected with the student newspaper and started writing feature stories, which has always been my favorite kind of thing within the journalism realm, to really be able to do that storytelling, to kind of dive deeply into something, whatever it is. And some of my favorite stories that I wrote for the paper in college were in-depth interviews with different folks. So we had a couple who had graduated from the university that was on Who Wants to Be a Millionaire. And I remember I got to interview them about that experience and really kind of tell their story of how they met at UVA and what that was like, and being on the show. There was also a like daily show-esque like comedy news show that 2 guys at UVA started, and I got to interview them about that, and they were also hilarious, which was a bonus. So that was another piece that was really fun to write. So yeah, just getting to tell people stories, I think, is what really drew me to it.
Yeah, that's awesome, man. And I'm glad that you said that it's like nothing that kind of related to your degree or anything like that. It was just being able to go out there, hear different things that are related to like the campus and things that are going around the campus, and being able to tell those stories. And I think regardless, it's a great way to gain that skill and gain that confidence of writing, and probably definitely helped to get you into graduate school. So you said you got your Master's of Science in Public Health at Harvard University School of Public Health. But before we talk about that, you said that you stumbled into public health. So what was that process of stumbling into public health?
Yeah, so again, I mentioned I had gotten to this point pretty early in the biomedical engineering program where I was like, I really enjoy this academically, but I don't want to be in a lab pipetting things. I don't want to be in front of a computer modeling things all day. Like, I need something more kind of community rooted, communication rooted, and wasn't really sure what that looks like. And yeah, quite literally stumbled into my RA from first year when I was walking on grounds. And she mentioned that she at the time was about to graduate, and mentioned that she was applying to graduate schools in public health. And it was just kind of one of those rare actual light bulb moments for me, where I was like, why have I never thought about that before? That sounds like it could be, the intersection of these things. And again, it's not something I was super familiar with, but once I started looking into it and what it entailed, it really checked all the boxes of the things that I wanted to explore.
Okay, well, yeah, that's awesome. I'm glad that she was able to be there and to share that she was applying to MPH programs or just Masters of Science and Public Health programs, because I think that that is the case for so many of us, trying to get into public health. We know we want to do this type of work, but we just never have the word or the understanding for it. Then, as you said, the pandemic has put a light on public health. So people, it's less likely for people to say that they don't know public health is a thing, or that they didn't know that you can study public health and everything like that.
Yeah, absolutely.
And what was there a reason you decided to get your Masters of Science in Public Health as opposed to your MPH?
It was really just a virtue of the way the program was set up at Harvard at the time. So at other schools, I did apply to MPH programs, but the way Harvard and I think Hopkins too, at least at the time, were set up was that to get their MPH programs were kind of nine-month programs designed for folks with MDs. Mm-hmm. And for folks who are coming at it from different places, it was a Master's of Science program. So it was more kind of logistical than anything else.
Okay, fair enough. So was there any concentration did you get into other Masters of Public Health programs and then decide to do the MSPH, and like what was that thought process and reasoning behind that?
Yeah, so I was ultimately kind of debating between the University of Michigan and Harvard's program. And I was, to also answer your question about the concentration, I had applied specifically to health communication programs and places with health communication concentrations or whatever. And again, it was sort of like coming from this place of, journalism and communication and wanting that when I was applying to grad school, I was very specifically interested in health communication. We'll talk about how grad school kind of broadened my interests, but going in very specifically looking at health communications in both University of Michigan and Harvard had really, compelling programs, compelling faculty. So that sort of was what I was basing my decision on. Yeah.
Okay, absolutely, fair enough. And I think both of them are good programs regardless. So
absolutely, no, yeah, for sure.
Okay, so then during your MSPH, you were a project manager for Teen Parents Health Connector at the Center for Health Communications at Harvard School of Public Health. So tell me about that position.
Yeah, so again, part of what drew me to the program at Harvard was sort of their various kind of centers and faculty and research projects that were focused in health communication. So they had the Center on Health Communication that had, over the years, they had a big role in kind of the Friends Don't Let Friends Drive Drunk campaign and other kind of social marketing efforts. And they, at the time, were sort of starting to initiate kind of student-led projects through the center. And so this was one of the first projects, and there was a group of us who were involved, and it was in partnership with a nonprofit in Massachusetts that worked directly with teen parents. And so what we were trying to do was kind of create a website hub, which I'm sure if we were doing today would be social media and not a website, but is kind of a website hub intended to provide like resources and social support and all of these things to teen parents. And I think the part of that project that I was most involved in and has really stuck with me is doing focus groups with teen parents that this nonprofit worked with. And I think just, again, talking about different perspectives, really being able to hear about their experiences firsthand and try to use that to kind of co-design with them, what kind of information hub would be useful to them was really special.
Yeah, I could imagine. And that's awesome that there's a health communications center at Harvard and that you're able to like connect and do that type of work there. And then you also had a position as a research assistant in health communication to Dr. Vish. Sorry if I pronounced the last name incorrectly. Viswanath.
Yeah, that was really good.
Wasn't as hard as I was expected to be.
Yeah, no, yeah, Dr. Viswanath was and continues to be a real mentor to me, and was really one of the reasons that I ended up, choosing to go with the program at Harvard, was, being able to work with him, and his team is based out of the Dana-Farber Cancer Institute and does a lot of really community-rooted research and work, related to health communications, but they work very closely with communities in Worcester and other localities in Massachusetts, working directly with community members around, what kind of cancer prevention resources, they need and want, and how to bring those to them. And yeah, that was, again, an experience that I feel really fortunate to have been able to have, and to learn from him and everyone in his lab and the way they work. And I think, even now in my work, kind of one of the pillars that I'm most interested in is figuring out how to do more public health work in a way that is kind of co-designed and co-owned with community in meaningful ways. And I think a lot of that stemmed initially, from my work there, and seeing how they operated there.
That's a great vision to have for the work that you want to do from coming out from this. And I also want to highlight that you said that Dr. Vish Viswanath is still your mentor to this day, and I think that that's important to highlight. That he was one of the reasons that you chose to go to the program. You got to work with him, and he still continues to help and support you to this day, which is dope. And then you also had a position as a CDC control centers. I don't know why I have CDC control and prevention for the CDC/Harvard evaluation project. Tell me more about that.
Yeah, so that was actually a winter term course, and they, again, similar to the internship program in undergrad, I think having institutions that have kind of these established programs and partnerships, is just so valuable. And so Harvard has this established winter term program where they do kind of a week. We did a week on site at the CDC, kind of doing a crash course in program evaluation. And there were, in each team, there were 2 students who were taking the course, as well as one or more representatives from an organization that the CDC was working with that was seeking program evaluation support. So we kind of took this crash course in conjunction with folks from the organization. And then the second week of the course, we were on site at the organization, helping develop a program evaluation plan for them. So it was incredibly hands-on. And yeah, it was just 2 weeks, but I kind of think back to and refer back to that a lot. And I think thinking about kind of advice for students and others who may be listening, I think any course that really builds in that application piece is just so helpful, and really helps you understand and retain the material so much better when you have the opportunity to kind of immediately turn around and apply what you're learning.
Yeah, absolutely. And I think, as you said, just being immersed in it and being able to actually do it, because I know during your graduate school, there's a lot of theory and a lot of other things that are kind of up in the air kind of things. So actually being able to implement it and use it in a real world context, I think is very helpful. And as it just solidifies everything that you're doing even more so. And then you also had a position as a public health prevention specialist at the Virginia Department of Health Division of Injury and Violence Prevention.
Yeah, so that was the summer between my first and second year of grad school, and it's one of my favorite stories to tell students and other folks, because I got this internship literally by cold emailing someone. And it really was, I was in Boston, and it was my first time being even though it wasn't that far, but it was my first time being that far away from home. My parents live in Virginia, and I'd gone to college in Virginia and could kind of go back whenever. And so when I was in grad school for a year in Boston, was on and off like fairly homesick and really wanted to go home for the summer. So I knew I wanted to go home. My parents live right outside Richmond, Virginia. So I was like, okay, I want to find a public health internship of some kind in Richmond, Virginia. And Richmond's the capital of Virginia, so it's where the state health department is located. And so I had just, I think in the spring of my first year in grad school, took a suicide prevention course, which I loved and learned so much in. And so was thinking that that might be a field I wanted to explore further. And so the suicide prevention program fell within the injury and violence prevention department at the state health department. And I cold emailed the director of that department and was like, hey, I'm really interested in the work you're doing, potentially looking for an internship this summer, would love to learn more about what you're doing and, whether you take interns or whatever. That email actually got a response, which admittedly, I have sent many a cold email over the years that did not get a response. It's not like they're all magic, but I always encourage folks to not shy away from them because occasionally you do get a response. And in this case, it led to interning there that summer and then actually working there after I graduated from my master's program. So, yeah.
Yeah, that's a good setup there. And before we get into that, you also said that during your master's program, you were focused on health communication, but then it helped you like just think more broader. So how did that play out?
Yeah, so the kind of department I was within at Harvard was at the time called Society, Human Development and Health. I think it's now called Health, Behavior, and Education or something a little bit more along the lines of what other schools call that. But it was really rooted in social epidemiology, and a lot of the faculty were focused on social epidemiology, really looking at those social and structural determinants of health. And I still remember kind of my intro, like huge lecture hall social epi course. Really, and again, I'm someone who like didn't have a background in public health. I was a biomedical engineering major, like didn't really get an intro to public health until I was in grad school. And that course, and in general, kind of this understanding I was learning about how, the conditions where you live and work and play shape your health. That was really the first time I was hearing that. And it really struck me and really broadened my interest in public health beyond just health communication. I think going into it, again, I was interested in the communication side of things. That's what brought me in. But I was really thinking in kind of a narrow way about, so much of, at the time I was thinking so much of health is shaped by behaviors, whether that's nutrition or exercise or, substance use or what have you. And so I was thinking about communication as a powerful tool to influence behavior. And I feel like what this kind of understanding of social epidemiology brought me to the realization that like behaviors are not happening in vacuums, right? That there are all of these conditions that are shaping where we live and work and play, and those conditions have a huge impact on what our behaviors are. And so health communication in and of itself can only go so far without kind of the policy and systems and environmental changes. So I feel like I was already interested in everything, and then I got to grad school in public health and became interested in even a broader kind of angle on public health than I came in with.
Yeah, that's awesome. That's awesome. And I think that's the one unique thing about a master's in public health. I feel like I feel like when you usually get a master's, you get very specific on something. But public health is just a broad field. You get a lot of skill sets, and you get to do a bunch and touch on a bunch of different topic areas, which is something I think is very, very helpful. But I love that perspective that you shared. And how difficult was it for you going from bachelor's in biomedical engineering going into public health? Was that a hard transition?
It was ironically an easy transition academically, in the sense of like engineering was really, really super hard. And I just remember, like struggling for hours with problem sets and all, it was just incredibly hard. And so I feel like academically I actually, found in some ways grad school to be easier. But I also think a lot of that stems from being kind of truly interested in and passionate about the material in a way that, this is something I really wanted to do and felt like I wanted to do for the rest of my life. And I think that kind of brings a level of interest that probably like makes things feel easier probably than they are.
Yeah, and just the novelty of it and
Right.
like you finding yourself in it as this purpose-driven, passion-driven just makes it a lot more exciting as well. So that makes a lot of sense. Okay, so you graduated from your MSPH and you said you transitioned into a full-time job at the Virginia Department of Health. So were you doing the similar type of work, or were you transitioned and doing different type of work at this time?
Yeah, so kind of yes and no. So I was similar work in that I did go back to the same department, so within the injury and violence prevention department. But my internship was focused in suicide prevention. And at the time that I graduated, the job opening that they had in the department was focused on bullying and youth violence prevention. And they were just kind of starting a bullying prevention program out of the state health department. And so I was hired to coordinate that. And yeah, it was, working in state and local health departments, it did not pay well at all. But what it did do was get I feel like you have so much ownership. Like in some ways, I had more ownership in that job than I had in the jobs I had after that, because it was basically this one person, this one position that was coordinating this program, working with schools across the state and doing kind of technical assistance and training and different things. And yeah, I feel like I just had so much ownership in that role to like shape this program and set up the evaluation piece of it and think about what to ask in the grant applications and being able to go out to these schools and talk to folks. And yeah, really, really enjoyed all of those things. There were also a lot of things that were really challenging about state government, which are part of the story of why I left. But, there's a lot of bureaucracy, is very depending, I think it probably depends a lot on kind of what state you're in, what department you're in, who your supervisor is, like all of those things matter. But where I was, it felt hard to innovate. It was hard to kind of do something new. And I think that combined with kind of compensation lagging kind of what you would think of as market rates sort of all contributed to kind of why I eventually transitioned out of that role. But it was, I refer back to, the experiences I had there all the time and like loved the work I was doing and the people I was working with.
Yeah, thanks for sharing that, because I think there are pros and cons to any work environment, and I think it's just knowing ahead of time what you're getting yourself into, and maybe like even ahead of time you might envision something, and then when you get there, something different out. So yeah, I don't think anyone can fault you for wanting to step away if it was like just not what you thought it would be. So that's fair enough. And what was the timeline for this position and then getting into your Doctors of Public Health? Was this like at the same time, or how did that work out?
Oh, yeah. So no, I started the DrPH program a bit later. So it was interesting when I graduated with my master's program. I was very much like, I am not getting a doctorate degree. Like I wanted the entire time I was in the master's program, there was a part of me that felt, I don't know, not stifled, but I feel like public health is such an applied field that being in school for it in some ways felt like I want to be doing something about this. And so when I graduated, I was very much like, I want to go do something about all this. Not interested in a doctoral degree, not interested in kind of studying it more or whatever, right? I was like, I want to go do stuff. And then, lo and behold, a few years later, found myself kind of, again, thinking about grad school. And it really came about, I might be jumping ahead here. The reason I was looking at a DrPH program specifically was, the idea of kind of an applied, more leadership oriented doctorate degree where I was, after the state health department, I worked at Truth Initiative, which does the Truth Anti-Smoking campaign. And I was on the evaluation team for that campaign. And again, it was a very health communications kind of role. And really enjoyed it, learned a lot, but was interested in, I wanted to get back to kind of thinking across issues more, thinking, about those upstream determinants and policies and what that looks like. And so as I thought about that, and as I thought about wanting to take more of a leadership role, it felt like, a DrPH might help me kind of make those transitions as I moved forward in my career.
Okay, and that makes a lot of sense. And I'm sorry for fast forwarding a bit, but
no, not at all.
So rewinding a bit, so from the Virginia Department of Health, you moved to a position as a research associate at the Truth Initiative, as an evaluation science and research. Was that like the department?
Yeah, the department was evaluation science and research. Yeah.
Okay, so how do you come across this, and then what do you do in it?
Yeah, so as folks may remember, my mentor, Dr. Viswanath, is actually the reason I even knew about this job or got to it. So I had reached out to him when I was, kind of realizing I was ready to transition out of the role at the state health department. I was really interested in moving to DC, having had interned there before and kind of wanting, I'd been in Richmond for a while, wanted to make a move. And so I knew I wanted to look at public health roles in DC and had kind of mentioned this to Dr. Viswanath, and he knew the director of this evaluation science and research department at Truth Initiative and knew that she was hiring, research associates. And so he connected us and I applied for and, interviewed for a role there. And yeah, spent, Truth was, our team there was just so amazing at the time, and people that I'm still in touch with and friends with. And it was a really cool experience. I hadn't done, tobacco prevention work before, but had certainly done, health communication work and had done, kind of research and evaluation before, but being able to kind of piece it all together and do it on a team that had a lot of young people my age, which was different from my experience at the state health department. So, kind of having that camaraderie and being able to really learn more about what social marketing campaigns are like, what does evaluation look like. The Truth campaign is also unusually for public health, a very well-resourced campaign. And that meant that the evaluation of the campaign was actually quite robust and, could really be done in in a way that I think is more rigorous than a lot of public health campaigns are able to do, just from a resource perspective. And so, yeah, I feel like it was a really great learning experience in that sense.
That's awesome. And I'm glad that you highlighted that Dr. Viswanath helped and support you get into this role, because I just think like that is important to just for people to hear and know that, you know, these connections that we've had in the past can really be leveraged and just have real relationships, so that they're willing to say yes. They can advocate for you and say yes. Vinu is going to be a great asset to the team and things like that. I think is hugely important. So that's awesome. And then during your time there, you got promoted or shifted into a senior research associate position. So what more responsibilities or what change in roles comes with that change in job title?
Yeah, so in some ways, I think kind of formally, I don't know that there was a ton of change in what I would like. I was still working on the same projects, and still had much of the same role, but did kind of organically over time, and kind of, I would say, parallel to that promotion, as opposed to necessarily because of it, but kind of parallel to it, did have more ownership over, kind of pieces of the evaluation. This was a really large evaluation of a national campaign. So, certainly at my level did not have ownership over the entire thing, but there were kind of pieces of it. And we were really, at the time, the parts that I was most involved in were around the digital and social media campaign, and really getting to think through, with kind of the ever evolving online social media landscape. The campaign was, I think pretty cutting edge in the way it was using social media and the internet. And so being able to kind of be on the ground thinking about, like, how do we evaluate this? How do we understand whether or not this is working? And just being able to kind of take more ownership over pieces of that work was pretty exciting.
Okay. And if you remember, what is like one of the main metrics that you all were using to see if this was working or not?
Yeah, so I mean, the overall campaign was, we had a longitudinal survey where we had kind of a nationally representative cohort of young people that were being surveyed every 6 months, and we were trying to track, obviously, their exposure to the campaign, but also how their tobacco-related knowledge and attitudes and beliefs were shifting. So that was really the main metric overall, was, are we shifting these knowledge, attitudes, and beliefs that we, in theory, believe are connected to their behavior. And we were, of course, also tracking behavior change, what types of tobacco are they using, how frequently, et cetera. So yeah, just trying to draw those connections between exposure to the campaign and knowledge and attitudes, and ultimately behavior change.
Okay, that's awesome. Thank you for sharing that. So after this position, or like during this position, you decided to get your DrPH at George Washington University Milken Institute School of Public Health. So when during this job or in that timeline was that the bug going off, okay, I want to get this Doctorate of Public Health?
Yeah, so it was, during my time at Truth. I don't remember exactly like how far into my tenure. I think probably like a year and a half into it. And I think another, it is also exposure. A lot of people I was working with at Truth, in more like director roles, et cetera, in the research department at least, did have PhDs. And so I think some of it is exposure and being like, oh, like, they did this and this is what they get to do now. And that seems kind of, interesting to me. So that was certainly part of it. And then the other part of it, again, was sort of wanting to transition from kind of this health communication specific, tobacco prevention specific role, knowing that I wanted to transition to doing bigger picture public health, bigger picture, thinking more, not thinking about communication, but also in conjunction with policy and systems and all of that. So all of that is what motivated me to apply to programs. And I actually only applied to GW because it was the only local. I knew I didn't want to move. By that point, I was married and we were in DC, and I was like, I'm not trying to move. So I knew I wanted to be in DC, and I wanted a part-time program because I wanted to continue working. So GW was it in terms of my menu of options. And so that's where I applied, and I'm really, really glad I got it and got to do that. So I was part-time. I did the DrPH part-time. I actually switched jobs in between while I was doing the DrPH, transitioned from Truth to Trust for America's Health, again, motivated by, wanting to do bigger picture public health, is really what motivated that transition. And then worked at Trust for America's Health while I was finishing up my DrPH. And ultimately, I think I defended my dissertation proposal when I was like 8 months pregnant, and then had the baby, had maternity leave, went back to work at Trust for America's Health, and was trying to write my dissertation at the same time. And it became quickly apparent that all three of these things could not happen at the same time. And so that is actually when I kind of stepped back from my full-time role at Trust for America's Health, decided to focus on, the baby and the dissertation. And that actually ended up being my transition into consulting, which was not, premeditated so much as kind of just happened organically in that process.
Okay, that's awesome. Well, thank you for sharing that. And we'll get into the Trust for America part. What were some takeaways, and I should say also kudos for you for defending your dissertation proposal 8 months pregnant. That's pretty impressive. I think anybody would think so.
I think it's there were a couple of us who at different points during this program had children, and we would joke about how it really motivates you to finish, because you're like, nope, this is getting done.
Well, I'm glad you got that extra motivation on your side. Definitely helped. How was that process doing it part-time? Did you find that beneficial, and was it everything that you wanted from it?
Yeah, I really appreciated the ability to do that. Both, I think financially, it is really hard to go from having an income to not having an income. So I feel like for many folks who, it was one thing to go, and I went straight from undergrad to grad school, didn't really know what I was missing in terms of, but then after having worked for several years, it was really hard to think about what life would look like without an income. So, I really wanted to maintain that. And then of course there are a lot of benefits, again, this kind of application piece, right? I think there are a lot of benefits that come from being able to be kind of absorbing new information and doing coursework while you are in a job where you can actually use it. And I got to, there were class papers and things where I got to kind of bring in things that I was working on at work and vice versa, and really make it practical and useful in that way, which was really helpful. And then of course there are parts that were really hard. And, being in class twice a night, now I can't imagine. And I did not have kids when I was taking classes. There were other classmates that did. And now that I know what it's like to have kids, I'm like, I have no idea how they did it. But, we were in class in person 2 evenings a week for a couple hours, and, the commute to those classes and back home. And it was a lot. And, it was definitely worth it for me. And I'm really glad I got to do it. But yeah, I don't know that it would have worked really at another time in my life.
Okay, that makes sense. And just for clarity, you were working your full-time job and doing the DrPH part-time.
That's right.
Okay,
yeah.
Awesome. Were there any other takeaways from your DrPH that you wanted to share with us?
Oh gosh. I think this application piece, I liked what you said earlier about kind of the value of those gap years. I I had, some internship experience and whatnot, but ultimately went directly from undergraduate to grad school. And I give similar advice to what you say when students ask me now. I think if I rewound and went back, I probably would take time to work in between undergrad and grad school, because I think that just gives you such a different perspective and like an ability to then learn course material in the appropriate context, when you've had that work experience. And so that's something certainly in the doctorate program that I feel like in a lot of ways I got more out of it, because I was able to connect it to things in real life in more meaningful ways. And then the other thing is just, I think I had a much better mindset towards school. I think, I'd always been a very like school oriented person, like all, as a child growing up, and then through middle and high school, and then went straight to undergrad and then grad school. And so was always, school all the time, and like spent a lot of time on it, obsessed over it a lot, et cetera. And then, being in this DrPH program part-time, had work full time, eventually in the dissertation stage, had a child, whatever. I feel like all of that just gave me the right mindset of, there was no obsessing over school. There was no like, spending forever on assignments. It was just do what you can and kind of maximize what you can learn out of an experience. But I was much less concerned with grades or that kind of stuff, and much more interested just in learning what I could out of the experience.
And that makes a lot of sense. And you said your position as a health policy and communications manager at the Trust for America's Health happened towards the end of your DrPH. Is that what you said?
Yeah, kind in between, really. It happened in between. I was probably had finished the bulk of my coursework, but was still had some coursework when I made that transition. And yeah, it was in some ways was sort of like tricky and not really what I had initially planned. I hadn't planned to switch jobs like during the DrPH program, but just was starting to feel really boxed in my role, again, sort of this narrow health communication, social marketing focus, specifically in tobacco control, which is a incredibly important field. But it was just, I just wanted to go back to kind of that, wide-eyed master's student, like realizing that everything is interconnected, and really wanting to be able to work in public health in a way that didn't feel siloed, both topically as well as in terms of like kind of what I was working on. So Trust for America's Health is an organization that I had been aware of for a long time. And, there aren't all that many public health organizations that really are looking at public health writ large, right? I think even within public health, there are lots of silos, lots of places that are focused on a specific issue or a specific type of work. And Trust for America's Health was a place where they, really did have kind of this wide lens. And so that is why when I saw this position, I knew I wanted to apply. And yeah, definitely while I was there, it was extremely different from my role at Truth, both in terms of the nature of the work. I wasn't writing academic papers anymore, and that was a big transition for me that, folks, my supervisors and others at Trust for America's Health, like really had to help me through that transition, because I was used to writing for academic audiences, and that is not what policymakers are interested in, and that is not what the general public is interested in. And I in some ways had kind of like not forgotten, but I would say like my journalistic roots had maybe gotten dusty, right, after a few years of like very academic focused kind of work. And so, yeah, it was a big transition, but one that I really learned a lot from and really appreciated, kind of being able to take that wide angle lens again and think about policies, think about all those upstream determinants, and how do we address those in ways that are, interconnected. It's where I got really, that role at Trust for America's Health is where I got really interested in the idea of multi-sector community health improvement efforts and what those look like and who's involved and what kind of policies can help, support and scale those kinds of efforts. So it really, in a lot of ways, shaped a lot of what I do now. And then the part of it that I really struggled with, and this kind of leads into the consulting origin story too, of I was really glad to be taking this wide angle lens, to be working on big picture public health, to be thinking at the level of policies and systems. But I was also getting kind of increasingly frustrated that, I was taking this 30,000 foot kind of view, and it made me feel really disconnected from the communities on the ground where the work was actually taking place. And it, like, I really struggled, like, okay, we put all this effort into this report. Like, what does that mean? Who's reading this? Is it having any impact? And for me, like, that disconnect was too much. Like, I knew I really wanted to in some way, shape, or form, be more connected to the communities in which the work was taking place. And so when I ended up transitioning into starting my own consulting practice, that was a gap I was really seeking to bridge in my work, where, I had a real appreciation for an interest in the systems and the policies and all of that, but really wanted to work on advancing those things with particular communities that were doing, work in their backyards. And that's a lot of the transition that I have been trying to make in my work.
Okay, and I want to highlight a couple of things you said there. First of all, like the writing part, especially during graduate school, during your DrPH, during your PhD program, if you're in a PhD program, you're going to be doing a lot of academic writing, but then coming out into the real world, a lot of that writing is a no-go depending on what kind of audience you're writing to. So that's definitely something to think about. Are you like only refining the skills that is academic writing, or are you refining skills that you can write and tell health communication stories and health promotion stories to a regular audience of people who better understand you? And then I think the other thing that you said that I want to highlight was you're seeking out like the systems level, or like wide lens of how can I get like the high level change that needs to happen for populations to really get that change. But then when you do that kind of work, most of the time it isolates you and takes you away from doing that ground level work where you're really working with community and doing the day-to-day work with them. And I think that's like important considerations that people have to think about when they are going into the public health workforce and thinking about what kind of impact and what kind of work you want to do, because those are two different types of things, and for the most part, they do not intersect, or don't intersect a lot. So that I'm glad that you highlighted that. Okay, so you're the founder and principal consultant at Pop Health, Pursuit of Public Health LLC. So first of all, when did you start this?
Yeah, so there's kind of the transition into consulting, and then the transition into kind of actually turning it into a consulting practice. So the transition into consulting happened when I stepped back from a full-time role at Trust for America's Health to write my dissertation. At the time, I transitioned to consulting just for Trust for America's Health. So it was consulting for my former employer on a part-time basis, and they were my only client. I think until I graduated. So, I was working on the dissertation, consulted part-time. And after I finished the dissertation and graduated, was sort of thinking about what's next, and was not interested kind of at that point, either personally or professionally, in kind of going back to a full-time in-person, kind of role. And so, I was like, well, I've been consulting for TIFA. Maybe I can try to turn this into more. And so that's when I started, more actively seeking other clients, and kind of, did the LLC paperwork, and kind of really committed to kind of making this my full-time thing. So yeah.
Okay, that makes a lot of sense. What was that process like for you reaching out to clients? And I also want to highlight that you said that you started off with contracting for your employer, former employer. And I think that is the case for a lot of people when they go into public health consulting. They're either going to be consulting with their former employer, or, well, their recently former employer, or
Right,
like
or
their
further back.
former
Yeah.
employer, or just through connections through those employers and
Right.
people that you spoke to doing that kind of work. So yeah, I can't remember the question I asked you, but I hope you remember it.
I think I remembered it until you said that, and now I'm like, oh no, do I remember it? But in terms of the transition.
Oh, the question was how did you you said that you took on your former employer, and then you started taking on other clients to make this more of a consulting firm. How did you go about doing that?
Yeah, it was really hard for a really long time. It was a lot of outreach, and exactly what you were saying before. I mean, I think a lot of it is network. A lot of it is people who can vouch for the quality of your work, connecting you with people who need that kind of the kind of support that you're providing. So and I had some of my early contracts, one of them was another kind of cold email situation, which that may have been the first and last time as a consultant that resulted in something for me. But I, had seen this paper about, there's a group out of George Mason University that was working on financing for multi-sector community health improvement efforts. And it was sort of the intersection of like economics and this multi-sector work I was interested in. And it like really spoke to me. So I cold emailed, the author of the paper, who was at George Mason, and it, led to kind of a small contract where I was supporting some of the work they were doing on, researching social determinants of health metrics and that sort of thing. But besides that, one of my early projects that I actually still work on was through a mentor at GW who I met when I was doing the DrPH program. And she runs a center at GW focused on health in schools. And I had TA'd for her mental health promotion class. And, she's, again, another, like Dr. Viswanath, another person who has been and continues to be a real mentor and an advocate for me, Olga Price. And so she had reached out because the center had a project on which it was seeking, additional consulting support. And I got to start working on that. And it's focused on school mental health in DC, working with a multi-sector group that's trying to identify kind of systems level improvements to DC school mental health system. And really was, I think, probably my first project as a consultant that really did that bridging that I was looking to do, where it was focused on systems and policies, but very much working with a group of people who are rooted in the district, and looking to improve lives for students in DC's school system specifically. And so, yeah, so it kind of started, with a couple of things. And there have been times, I mean, even as recently as last year, kind of the first 3 quarters of last year, I wanted a little bit more work than I had, and was doing a lot of like submitting proposals and like reaching out to folks and doing a lot of that kind of business development work. And it wasn't really until probably the last quarter of last year that a lot of things fell into place at the same time. And, all of a sudden was, had more work that I knew what to do with. And so it's sort of like these ebbs and flows of consulting and working for yourself. I think there's a lot about it that I really love, and in a lot of ways can't really imagine right now going back to, kind of a traditional employment situation. I love the ownership you have, as a public health entrepreneur, in choosing what you work on, in being able to kind of shape a portfolio of projects that's kind of checking your boxes of the kind of work you want to be doing. And again, for me, it was really like bridging that gap. Like, I want to be doing big picture systems policy work, but I really want to be doing it hand in hand with specific communities. And really appreciate that. Really appreciate, of course, kind of the flexibility of being able to set your hours, and no one's expecting you to, be online from 9 to 5 days a week or whatever, and being able to shape that. And then on the flip side, there's a lot that's really hard. The business development side is really hard. The ebbs and flows are really hard. I'm terrible at like all things kind of logistical paperwork, like all of the invoicing and the billing and the taxes and all of that. Like, I don't enjoy it at all. But as in this role, you have to do all of it. And so, I think pros and cons as with all things, but I think for me, the pros it brings are really, really strong. And so I've really appreciated being able to do this. And also, I think being able to do this, especially in this country, is a position of privilege. I think I'm married. My husband has healthcare benefits through work. And if it were not for that, I don't know that I would ever have transitioned into this. Like, I think it would have been too scary to either like not have insurance or have to shell out a lot of money for not great insurance. Like, those are all really tough decisions. And, I was in a position where I didn't have to do that. And so that really made this possible in a way that, at least for me, I don't know that I would ever have made that leap without that kind of safety net.
Yeah, I don't think that is absolutely fair, because it is a big leap, and especially as you said, all the stuff, public health, with all the like back end business stuff is a whole new world and a whole new bunch of things that you have to learn and have to really build out the systems to be effective at doing that kind of work as well. So when you say that you work, you focus on like multi-sectoral work, what does that mean?
Yeah, it is really, I feel like it's such a conceptual academic kind of thing. And I feel like I am still kind of learning how to make it concrete and just more understandable. But I think one of the best ways to do that is just with an example. So for example, this group that I've been working with in DC is it's called the DC School Mental Health Stakeholder Learning Community, and it has family advocates, it has schools, charter schools and other kind of school personnel. It has healthcare folks, it has folks from the Children's Law Center and other kind of child trends like policy research and policy advocacy organizations. And folks from across these different sectors coming together to try and piece together an understanding of what the school mental health system is actually like, and really especially trying to understand what it's like from the vantage point of students and of families and of educators, and then use that understanding to then identify kind of specific policy changes, organizational kind of like school, both kind of the big P, little p policy, as they say, right? So yes, there's kind of district level governmental policy changes that could help, more kids in DC schools, have optimal mental health and well-being. There are also kind of policy changes at the level of a school or a level of a classroom that could also help. And so thinking about what those different kind of levers are that you can push on to strengthen the system. And some of that has to do with, the connection between healthcare and education, and the connection between various, district agencies, whether that's child welfare or housing or what have you, how do all of these different sectors, different agencies, different organizations, how are they communicating or coordinating with each other? What kind of, what kind of data sharing is there? What kind of, what kind of connections are we making between folks? And then also not just thinking about it from kind of like a case management referral perspective, even though that's an important part of the puzzle, but also trying to think about that more upstream prevention. How do we change the neighborhood conditions, the school conditions in the first place, so that these treatments and services are not necessary for as many people. So I don't know if that helps kind of explain.
Definitely think it helps, because as we see in public health and in health in general, health is very intersectional. It intersects with a lot of factors, as we know, the social determinants of health, the political determinants of health. You can talk about structural determinants of health, and this intersectionality there. So like having all these players who are parts of all these systems, or just playing a different part in whatever that work is hugely important to get like a robust change, and one that's sustainable, and as well as like reducing the amount of adverse effects that come out of whatever you're trying to do, is having everyone at the table and have their perspective shared and appreciated. Okay, so before I move you on to the last sections of the show, I wanted to talk about your TEDx talk, which is called SquarePeg Round Hole, Fixing Our Approach to Health. And I will link it in the description for everyone to check out. Definitely, if you're in public health, you would love it. I enjoyed it a lot. Before I ask you more about like the TED talk itself, what are the logistics for getting onto like a TEDx talk?
Yeah, absolutely. So it's interesting because the kind of national TED, whatever, the big platform is, as far as I know, kind of invitation / nomination only, and like a little bit of a black box. The TEDx local events are much much more open, in the sense of most, maybe all of them, but certainly most of them have an open application process. And so this is something, we talked about, like I've always been interested in communication, really am one of those people who actually have always really loved presenting. Like I love putting that story together. And so I had been, kind of looking for more opportunities to be able to share kind of the narrative of public health with people. And so kind of randomly stumbled upon this particular local TEDx event. They had done like a speaker panel where people who had spoken at it the previous year, which was actually the first year of this particular TEDx program, had just done a speaker panel to kind of share with folks about their experience and let them know, about the process for next year's TEDx. And I had heard about and attended that speaker panel, and then decided, wanted to put in an application. And so I applied. It was a written application, asked some questions about what's the idea that you want to share, and, why are you the right person to talk about this idea, that type of thing. So a written application. And then it was funny, I actually had applied, this was like just pre-pandemic. So they were supposed to review applications in like March-ish of 2020. And so then they had sent out an email being like, well, clearly, we have no idea if an event can happen. So we're just going to kind of table this and not review applications this year. So a year passed, and then the following year, they had emailed those of us who had applied the previous year and were like, hey, we're opening up our applications again. Feel free to resubmit. So I resubmitted and was selected as one of 10 speakers for this event, and kind of went from there. And again, kind of similar to what we were saying with the universities and kind of having the structure of these different programs. Having the structure of something like this was really useful because there was a planning team. They connected you with a speaker coach who in my case was someone who had spoken at this event in the past. And, they have, various kind of like deadlines and things to help you move through the process. And like all of that structure was really helpful in kind of putting the full talk together.
Okay, that's dope. I didn't think they would have like speaker mentors or all of that, but that's good that they have that system set up there to help you. And yeah, you definitely it was very well done, very polished. So kudos to you, and a great job on that, because I know that in itself isn't easy for a lot of people to do. So that's awesome that you're able to get that opportunity and share such an amazing story.
Thank you. Yeah, it was such a process from beginning to end. I haven't had time to do this yet, but I've really been wanting to go back and look at like the first draft of the talk, because kind of first to final was a world of difference, and like so many things that went into kind of, shaping it and revising it and re-revising it, and really trying, with the help of my speaker coach, with the help of kind of, my husband and my best friend and people I was like running things by, frequently. And yeah, it really morphed a lot through that time. And so, yeah, I'm really grateful to have kind of had the experience and like the kind of in some ways like have a reason to kind of go through that process and put this together, because I think it's investing that kind of time and energy probably wouldn't have happened if there wasn't a reason to do it. And so yeah, really grateful for that.
Yeah, which makes a lot of sense. Like you might have wanted to do this all the time, but It was just like, it's like, oh, I can, but like now actually having that reason and having that structure definitely helps. So that's dope that you're able to do that. So in your talk, you speak a lot about round peg solutions to square hole problems. Is that correct? Am I saying that correctly?
Yeah.
So would you like to just speak a little bit about that?
Yeah, absolutely. I mean, I think what has really struck me, as I learned about public health, and I feel like this talk is really like a 10-year build up from kind of my first entry into public health. I feel like what I've always been so struck by is just that this kind of like fundamental mismatch, right, between the way we as a society, as well as individuals, the way we think about and approach health versus the way health is actually shaped and determined. And I think, and this is how I start my talk, like, you ask people about health and your typical person is thinking about, oh, this is what I had for breakfast, or this is how I worked out yesterday. I went to my doctor last month. It's so individual level, the way we think about health, and what we know as public health practitioners is that, research shows over 80% of our health is determined by the conditions where we live and work and play. And it is ultimately a population level problem that we keep kind of trying to force these individual level solutions, right? So that was sort of the origin of this idea of, square peg, round hole. We keep trying to force these square peg individual level solutions in to solve what is a population level problem, and it's not working. And, you know, we see that in health outcomes, we see that in, you know, health inequities, we see that in healthcare costs. And until we really align those solutions and get to those round pegs that are actually going to approach health at a population and systems level, until we do that, you know, I don't think we're going to see the kind of improvements to health inequity that we all want to see.
Yeah, I can completely agree. And if you agree and you want to hear more about that, definitely check out the talk linked in the description and in the show notes as well. Okay, so before I move you on to the Furious Five, I wanted to ask you, where do you want to see yourself in the future?
Yes, this is a great question. It's one I continue to grapple with. You know, I feel like people joke about how, like, you know, you're kind of perpetually asking yourself, what do I want to be when I grow up, no matter how old you are. And I, you know, that's definitely true for me. But I think that it's kind of a two-part answer. So I want to continue to kind of deepen the way I work with communities to address these, you know, big kind of policy systems changes that we need. And I really enjoy working with these, you know, multi-sector groups that are, again, like focused in a particular community. I've gotten to do that in a few different places now, and that is always the work that I find most rewarding. So I want to continue to do that and find ways to support more communities in the work they're doing. And I haven't quite exactly figured out what that looks like, but that's, you know, one part of what I want to do. The other part of what I want to do is related a lot to kind of the TEDx and this idea of being a voice and an advocate and an activist that's bringing a public health lens to non-public health spaces. I feel like we can do a lot of talking within our bubbles, but that doesn't really help shift or change the way society works or the way, you know, policies are. And so I like, and I get really passionate about, you know, telling that public health story and bringing that public health perspective. And so I want to find more ways to kind of get into non-public health spaces where that voice doesn't exist, and to be able to bring that perspective and hopefully bring people along in you know, taking more of this prevention oriented, you know, systems oriented, population oriented approach.
Yeah, I like that a lot, because I feel like public health is in all spaces, and being able to speak to it, because I think as public health professionals, like, especially like just traditionally in the past, we have not done a good job
Right.
of speaking to other sectors. We have not done a good job of like that multi-sector collaboration that you're talking about. There's a lot of space that can be done and just having those conversations are so important, because as we've said in this interview, the how health is affected is very intersectional, and it spans a lot of different factors in your life. So yeah, I definitely look forward to seeing what you do, and then how you're able to reach this vision of doing that type of work. So look forward to seeing that. And then moving on to you're most welcome. You're most welcome. And then moving on to the last section of the show, the Furious Five, the 5 questions I ask all guests. So number 1, what advice would you give to a student trying to pursue a career in public health?
Yeah, so I think it actually goes back to what I was just saying. I feel like my advice would be to think about how to contribute to broadening the tent. And what I mean by that, again, is like, I feel like a lot of public health work can be insular, or, you know, kind of preaching to the choir in the way that we, in kind of what we're doing and who we're talking to. And I think advancing the field, as well as sort of in, you know, kind of finding a unique niche for a particular student, I think there's so much to be said for figuring out what you can do to like broaden the tent and bring more people into the fold of understanding public health and how it works. And I think that requires a level of open-mindedness to meaningfully engage with people who you might disagree with. I think we've, as a society, gotten really bad at doing that. And I think it is really to the detriment of public health and of all of our well-being. And, you know, if we are just talking to the people who agree with us, like there's a reason we're not shifting policies, right? Because there's a lot of people who disagree with us and we haven't moved them at all. And so I think trying to figure out how to have those meaningful interactions with people who might disagree, who don't see things through a public health lens, and figuring out how to, and I don't mean like brainwash other people, you know, or change, but like actually listen to what their concerns are and find ways to, you know, to advance public health that are more appreciative of, you know, of different perspectives and of actually being persuasive, as opposed to just talking to the people who already agree with us. So sorry, I feel like that was a very long answer, but
No, but I definitely agree with the point that you're making there. We definitely are very siloed in our communication, and that is to the detriment of a lot of things in society, because we aren't having that over the border conversation with people who have different mindsets and finding commonplace with them. So yeah, I appreciate you bringing that up. And then two, if you were talking to someone wanting to get into your position, what advice would you give them?
I think the key advice, and I am still trying to take this advice, it is one that I struggle with, but I think to know your audience. So as you know, assuming you mean like as a public health entrepreneur, as someone who's, you know, kind of trying to build this kind of practice, I think it's so important to have a very clear understanding of who your audience is, and for that to be in some ways fairly narrow and specific, so that you can actually meaningfully tailor and target what you are offering to the needs of that audience. And it's something, again, as someone who has always been like interested in all the things, that is something that I'm still kind of grappling with and trying to figure out how to do. But I think that would be my key advice.
Yeah, that makes a lot of sense. Number three, what's something you're working on improving in your life right now?
Yeah, so focus, being present, is something I have been really struggling with, and have, you know, begun to kind of make a more concerted effort to do that. And I mean, like in all areas, like whether it's work or kids or otherwise, I feel like there are, you know, so many, no worries. I feel like there are so many distractions and challenges in just being able to stay focused and present. And I actually just got this book that I've just started reading called Stolen Focus. It came out really recently, but it's funny. The author actually makes the argument that, similar to my TEDx talk, makes the argument that this is not an individual level problem, but that there are actually, you know, our current society has been structured in a way that has stolen our focus and made it really hard to pay attention. And so I'm really excited to get deeper into this book and kind of learn more about what the various systems are. I mean, obviously there's like the technology and the social media and that side of things, but I think there's a lot of other systems and ways society is structured as well that are contributing to this. And yeah, that's what I'm focused on, both kind of sort of like individually, what can I do about it in my life? But I'm also interested to kind of explore more about like what are the various systems that are making focus and attention hard, not just for me, but for all of us, and how might we go about reshaping those things? Because I think it really is like, it's not just about productivity, it's about, kind of having purpose and meaning and feeling fulfilled and your general well-being. I think a lot of that is affected by whether or not we're able to be present and focus on whatever it is.
Yeah, absolutely. Why my phone rings. That's one of the systems that has set us up to break our focus. But yeah,
Yeah.
that's definitely very interesting, and I think that's a very insightful way to think about it. Beyond just like the individual productivity, what are the systems around us? And as we all know, social media is one of them, but there are probably a lot of other ones that we just don't think about on the surface
Right.
that are affecting our focus and productivity and all that good stuff. So thanks for sharing that, and thanks for another book that I got to put onto my never-ending book
Right,
list.
right.
Number 4, professionally, do you recommend anything?
So I feel like this is a very common recommendation in kind of the consulting and especially public health consulting world. But I, from a recommendation, picked up the book Company of One pretty early on in my consulting journey. And yeah, just found it incredibly insightful and helpful in just being intentional about what it is that, if you're interested in kind of going into business for yourself, just how to be intentional about that and not just, pursue growth for growth's sake, but really think about, what are you growing for? What do you actually want? Are you interested in working less to have the same amount of impact, or whatever combination of things, but just being intentional, and I found it really helpful.
Yeah, that's awesome. Definitely another book that I'll add to my list. And I think like intentionality in life is a
Yeah.
great framework to go ahead, and also in business. And I think a lot of us, we do not do enough of that intentional looking within, or like pushing to do like the types of things that we want to intentionally think about and do. So yeah, that's dope. And thank you for that mention. And then last but not least, where can people connect with you?
Yeah. So Twitter, I'm at Pursuit of PH, and LinkedIn with my name. And my consulting practice website is pophealthllc.com. So any of those places are great. And yeah, I would love to connect with whoever. I'm always excited to connect with folks who are interested in public health. So
Awesome. And I'll be sure to link all of those in the show notes for anyone that would like to connect with Vinu, or Dr. Vinu, I should be saying. Thank you so much for taking time to come on and chat with me and share a lot about your story. I definitely think it was very insightful. It's going to be helpful for a lot of people moving forward.
yeah, well, thank you, Omari, for having me, and thank you for doing this. I think it's so exciting that there are public health podcasts and people who are people like you who are providing this kind of connection and information to folks. So thank you.
Yeah, thank you. I'm glad to be filling this gap and just helping people get information that I wish I had during my public health journey, right?
Exactly.
Yeah. So housekeeping items, everyone. Thank you all so much for watching. Be sure to subscribe if you have not as yet. Be sure to like, be sure to review. I know Spotify just opened their reviewing portal, so definitely review on there if you listen on Spotify. Share it with a friend, and if you'd like to support, you can go to thephmillennial.com/support and look at different ways to support there, or go to buymeacoffee.com/thephmillennial and support there. But thank you all for tuning in, and I'll see you all next week.